Welcome, medical students, to today's lecture on the intricate histological details of the liver lobule. The liver lobule is the functional unit of the liver, and understanding its complex dynamics is crucial for comprehending various liver diseases and metabolic processes. In this lecture, we will explore the circulatory dynamics, stellate cells, hepatocellular carcinoma, liver lobule zonation, bilirubin metabolism, cellular heterogeneity, alcoholic liver disease, drug metabolism, liver lobule ischemia, genetic alterations, inflammation and immune response, and the role of liver lobule in drug clearance. Let's dive into the fascinating world of the liver lobule. The liver lobule receives blood through two major sources, the hepatic artery and the portal vein. The hepatic artery provides oxygenated blood, while the portal vein delivers nutrient-rich blood from the gastrointestinal tract. These blood vessels form a unique network termed the sinusoids within the lobule. The sinusoids have a discontinuous endothelium, allowing direct contact between hepatocytes and blood components. This extensive network facilitates the exchange of gases, metabolites, and numerous other molecules. Stellate cells, also known as hepatic stellate cells, HSCs, are vital players in liver fibrosis, a pathological process characterized by excessive extracellular matrix deposition. In a healthy liver lobule, stellate cells exist in a quiescent state, primarily storing vitamin A. However, during injury or chronic liver diseases, these cells become activated and transform into myofibroblast-like cells. Activated stellate cells produce collagen and other fibrous proteins, leading to the formation of fibrotic scars within the liver lobule. Hepatocellular carcinoma, HCC, is the most common primary liver cancer and often arises within the liver lobule. Continuous exposure to various risk factors, such as chronic viral hepatitis infections, alcohol abuse, or metabolic disorders, can trigger the series of genetic alterations that eventually lead to HCC development. The liver lobule's cellular heterogeneity and intricate network provide an ideal environment for the growth and progression of hepatocellular carcinoma. The liver lobule exhibits zonation, meaning that liver cell functions differ along different regions of the lobule. The periportal zone, located adjacent to the incoming vessels, specializes in metabolizing xenobiotics and detoxifying chemicals. In contrast, the pericentral zone, situated near the central vein, contributes to the metabolism of bile acids, cholesterol, and ammonia detoxification. This zonal specialization ensures efficient metabolic activities throughout the liver lobule. Bilirubin is a byproduct of heme degradation and requires efficient metabolism for its elimination from the body. Within the liver lobule, hepatocytes take up unconjugated bilirubin and convert it into a water-soluble form called conjugated bilirubin. Conjugated bilirubin is then excreted into the bile canaliculi, from where it eventually exits the body through feces. Any disruption in this bilirubin metabolism can lead to jaundice and other liver-related disorders. The liver lobule contains various cell types that contribute to its structure and function. Apart from hepatocytes, which are the predominant cells in the hepatic lobule, other cell types include Kupffer cells, endothelial cells, and stellate cells, as discussed earlier. This cellular heterogeneity ensures proper liver function, allowing for diverse metabolic activities necessary for overall body homeostasis. Chronic alcohol consumption can result in alcoholic liver disease, which encompasses a spectrum of liver pathologies. In the liver lobule, chronic alcohol abuse disrupts the delicate balance of metabolic processes, leading to fatty liver, hepatitis, fibrosis, and even cirrhosis. Alcoholic liver disease serves as a prime example of how liver lobule dysfunction can contribute to the progression of severe liver diseases. The liver is the primary organ responsible for drug metabolism and detoxification. The diverse metabolic capabilities of different regions within the liver lobule ensure efficient drug processing. For instance, certain drugs may undergo phase I metabolism in the periportal zone, while others may undergo phase II metabolism in the pericentral zone. Understanding this heterogeneity is crucial for determining optimal drug dosage and assessing potential drug-drug interactions. Liver lobule ischemia, or inadequate blood supply to the lobule, can occur in various clinical conditions such as liver transplantation or acute liver injury. Ischemia triggers a cascade of events, including oxidative stress, inflammation, and cell death. The delicate vascular network within the liver lobule is particularly vulnerable to ischemic insults, making it a critical area of study for improving surgical techniques and management of liver diseases. Genetic alterations play a significant role in the development of various liver lobule disorders, including liver cancer and metabolic diseases. These alterations can affect critical signaling pathways, resulting in dysregulated cellular processes within the liver lobule. Understanding the genetic components of liver lobule disorders provides valuable insights into disease mechanisms, potential therapeutic targets, and personalized medicine approaches. The liver lobule is highly susceptible to inflammatory processes due to its continuous exposure to gut-derived toxins and pathogens. Kupffer cells, the resident macrophages within the liver lobule, play a pivotal role in initiating and moderating the immune response. Inflammatory cascades within the liver lobule are tightly regulated and, when dysregulated, can lead to chronic inflammation, fibrosis, and liver damage. The liver lobule serves as the main site for drug clearance and elimination from the body. Hepatocytes within the liver lobule metabolize drugs through various enzymatic pathways, facilitating their transformation into more hydrophilic compounds that can be easily excreted. The intricate network of cellular interactions within the liver lobule ensures efficient drug clearance while minimizing toxicity. In conclusion, the liver lobule is a complex and important unit of the liver. It performs crucial metabolic functions and is involved in liver diseases. Understanding its circulatory dynamics, cellular composition, metabolic activities, and response to diseases is crucial for medical professionals. Thank you for watching our detailed lecture on histology.